So welcome everyone to this is our third event. Vasanti had a brilliant turnout yesterday for a fertility event about a play around fertility and infertility. And we had the event about social media and women's health, which is also now on YouTube. And this event is called What Can Femtech Do for Women? And so welcome everyone. We are recording the event, so it will be on YouTube and shared on social media in a few hours, hopefully. And so Femtech is using technology for women's health, often digital technology, but not always. And it's a growing business with now estimated to be worth about 50 billion in 2025. Oh, you can see that as well. That's all right. You can see my notes. I might just move that. I don't know why I haven't shared screen yet. Oh, that's not going on the. That's why. It's all right. That's not going on the. It's not going on the Zoom's call, so that's okay. Right. So yes. So women are 75% more likely to use digital health tools than men. And Femtech includes trackers to monitor a woman's menstrual cycle, fertility, contraception, pregnancy, menopause, sexual wellness, and much more. So we're going to discuss some of those topics today. So this event is going to be a panel discussion with 3 companies that all make an app around women's health and support women at various stages of their cycle. So we've got Flow, a period tracker app, Natural Cycles, a contraception app, and Adora, a menopause app. So I'd like to now introduce our chair, whose name I always pronounce wrong, AJ, almost, I've written that there. So she has a first-class honours BSc in biomedical science and is a recent MSc reproductive science and women's health graduate from our institute at UCL. And she has a strong interest in research and has published 4 papers in peer-reviewed journals. Well done.
Thank you.
And on medical education and women's health. And she hopes to be a clinical embryologist. So I will now hand over and then I'll come and do the slides when we're ready.
Sure.
Is that okay?
So before I start introducing the speakers, I'd like to extend a warm welcome to everyone here this afternoon and happy International Women's Day. Now to our speakers. So our first speaker is Kimberly Peven. So Kimberly is a nurse by background and has been working in various aspects of women's and children's health for 14 years. After completing her PhD in epidemiology and newborn health, Kimberly has worked with the World Health Organization on a global reproductive, maternal, child and adolescent health policy survey, as well as on WHO and UNICEF's progress report for the global strategy for women's, children's and adolescents' health. Her current role as a senior research scientist at Flow Health includes designing and conducting research studies to validate technologies and collaborating with universities and other institutions to advance women's health research. Now I'll pass it on to Kimberly.
Just get the slides up.
Yeah.
There we go. Those online, can you see the slides okay? It's disappeared. Oh, here we go. Right, there we go. Is that your first slide?
No, but I can click back to
okay,
it.
no, just get you back. Right, there we go.
Cool, thanks.
That's looking good. Good.
Okay, so I'm Kim. I'm a senior research scientist at Flow Health, and I'm going to talk a little bit about Flow, what we do, and what Flow and Femtech can do for women's health. So first, a little bit about Flow. Our ambition is to be the essential health partner of 1 billion women worldwide. And we're trying to build a better future for female health by helping women harness the power of their body signals. And we empower you to take control of your health, stay well, and live better through intelligent and personalized insights. So I'll talk a bit about that. So what we do is provide actionable feedback through accurate cycle and symptom predictions. We also track unique patterns and trends for our users. And we provide personalized guidance through chatbots, health insights, and courses. Additionally, we provide daily information and support throughout pregnancy. And we have an area of the app called Secret Chats where you can discuss sensitive topics anonymously with women worldwide decreasing stigma for menstrual health issues and sexual health issues. So a bit about Flow in numbers. We have 50 million monthly active users and 280 million total installs. And 9 in 10 of our users say that it helps them be aware of their body signals. So what can Flow and Femtech do for women's health? There are 4 things that I think that we are contributing to particularly, and that's symptom checkers, health literacy, health management, and advancing women's health research. So first I'll talk a bit about symptom checkers. At Flow, we're currently developing several symptom checkers for common reproductive health issues that affect millions of people, yet they struggle to find and face frustrating paths to get a diagnosis. So endometriosis, for example, affects about 1 in 10 women or people assigned female at birth, and it takes an average in the UK of about 8 years to get a diagnosis. And so this is a long and frustrating journey for many people. So our symptom checkers could help by decreasing this time to diagnosis, by identifying these issues earlier for people, and thereby reduce complications from untreated conditions and potentially decrease healthcare costs. So we've just conducted a study on the accuracy of our symptom checkers, which is available now as a preprint, and it shows high levels of accuracy for identifying these conditions in patient case vignettes. So that's some really exciting news. So another thing that we can do, I think, is contribute to health literacy and bringing credible health information to people that need it. And so one thing that we're trying to do at Flow is roll out free access to Flow Premium to 400 million people over the next year in 58 different countries. So currently, we've been able to roll this out in 21 countries, and 2 million people have enjoyed Flow Premium access for free. And we're also trying to conduct some studies on health literacy and see how use of Flow might improve people's understanding of their health and their body. So another thing that we can do is assist with health management and help people track and manage the symptoms that they experience. So through this, at Flow, we're partnering with leading research institutions and conducting several different randomized control trials to evaluate Flow and its effectiveness in improving well-being, and quality of life for people who menstruate and people who manage conditions like PMS and PMDD. And additionally, we're conducting research on menstrual symptoms and how that impacts workplace productivity and how we might be able to improve management of these symptoms. And finally, I think that Flow and Femtech more broadly is in a good position to help advance women's health research. So additionally, we're partnering with different leading research institutions like here at UCL, Mayo Clinic, Johns Hopkins, and UNFPA to look at crucial yet understudied areas of women's health. So I'll just talk about a few of our recent studies that we've done. So we've been doing some research on PCOS, or polycystic ovary syndrome, which affects 8 to 13% of people with ovaries. And a recent study of ours looked at Flow users in 142 countries, and we found bloating was a really common symptom that people with PCOS report, and that also high blood cholesterol and blood glucose were predictors of PCOS. We've also looked at postpartum depression and COVID-19. So postpartum depression affects 10 to 20% of people who give birth. And we found an increase in postpartum depressive symptoms in the US after the start of the pandemic. So you can see in this chart kind of the level of postpartum depression symptoms over the period before and after the start of the pandemic. And interestingly, states that had greater increases in postpartum depression symptoms had fewer COVID deaths and also lower women's unemployment rates. Sorry, I'm not sure what the screen is doing.
I didn't want to interrupt you. Let me just try and. It's probably not doing it for those online.
I actually couldn't see it on here, but
Oh, really? Yeah.
there.
It's just, it's the screen, I think. Yeah. It's just,
Okay, cool. Sorry, that must have been really distracting. And then finally, another study that we've recently done is about stress and pain in Ukraine at the start of the war. So interestingly, we found this inverse relationship between stress and pain, where as stress reports increase, which you can see at the start of the war, pain reports decreased. So this kind of stress analgesia response. And this relationship was also found but in decreasing magnitude in neighboring countries to Ukraine. So in summary, I think that flow and Femtech more widely have a lot of opportunities to contribute meaningfully to women's health through things like tracking and identifying symptoms and issues and helping people identify conditions earlier, through providing medically credible information to people directly, and through advancing understudied aspects of women's health research, especially where we have access to large user bases that have consented to using their data for research and being able to conduct studies at a scale that was previously not feasible. So that's all for me. Next.
We'll have the questions at the end. I know there's some questions in the chat, but we'll just do those at the end. Right. Let's just welcome everyone online. We've got a growing group online. Let's just get Jack's slides ready. So I should have had more lined up. I had back-to-back meetings today, so it's been a bit crazy. Another day of back-to-back meetings. Right, let's just get Jack's talk. I'm going to open theirs as well. There we go.
Yes. Right, okay, now I will introduce our second speaker, Jack Pearson. So Jack is the medical affairs manager at Natural Cycles, the company that created the world's first FDA-cleared contraceptive app. He collaborates with academics and healthcare professionals, educating them about the product whilst performing novel research on the large anonymized data set collected from users. Jack previously worked as an embryologist in the UK's second largest IVF clinics for the NHS. Now I'll pass it on to Jack.
Thanks very much, and happy International Women's Day from me and everyone at Natural Cycles. So I'll start with Natural Cycles' mission to pioneer women's health with research and passion by empowering every woman with the knowledge that she needs to be in charge of her health. So I've put research and passion there at the top. Obviously, I'm very passionate about research, as are a lot of people here today. And it's a sort of like with Flow and other apps out there, you know, we've got so much data and there's so many great things that we can do with that data in terms of research. So a little bit about where Natural Cycles came from. The founders, Raoul and Alina, they are physicists, and they worked on discovery of the Higgs boson molecule at CERN in Switzerland many years ago. And then when they finished this project, Alina found a real gap in the market for non-hormonal, non-invasive digital contraception. So we've come a long way since we launched many years ago. We've got the Higgs boson there on the left, and then here you've got the app and how it looks today, with a basal thermometer used there by our users to take their temperature and put that into the app. And then just last year, we collaborated and launched and got FDA clearance for using the Adora ring. So this is the first sort of continuous measurement device for digital birth control. Gone are the days of taking your temperature every day. When you wake up, you just wear the ring and it takes your temperature during the night. And on the far right there, we've got kind of a little breakdown of the use of contraception. So from lemons all the way up to a wearable ring and an app there too. So we've come a long way, but there's still so much work to do in terms of what we can do for women. So here's a little daily routine of the Natural Cycles user when they're preventing a pregnancy. We still offer the methods, and it's very popular, of taking your temperature each day, or you can wear your wearable device, of which we're developing more than just the ring. Then you get your daily fertility status, You can enter lots of information there. So were you sick? Did you sleep badly? Are you hungover? Some other symptoms there. So are you bleeding? What sort of sex have you had? The type of sex, LH test results, mood, pain, and a whole host of symptoms there. And then the user gets their daily fertility status based on that temperature, the optional LH, and their menstruation dates. We can also send messages to users as well. So if we're doing a survey on something not related to the information that we're collecting in the app, we can send them a message to ask them a few questions too. All of our users are really proactive. We recently ran a clinical trial here in London in January and February, and the attendance to the trial was 100%. We had no people not turn up. Everybody was very keen to take part in research. And I think for me, working remotely, working for a tech company, actually meeting participants and how excited they were to be involved in the research, is a real credit to our users and how they want to kind of further knowledge in women's health. So yes, our users love us, and it's great to see, all feedback that we get on the app. I think that's another thing about sort of apps and tech. Someone can review us on the App Store, on Google Play. I see that on my phone. I can see exactly what they're thinking. All the different departments of the company can take that feedback on, discuss it. We can notice themes. And we've just got this constant dialogue between the individual using the product and then also the people that are designing it as well. And I guess I don't want to nerd out too much on the research, but obviously we love doing research. And I think, yes, lots of studies that we did initially looking at our effectiveness as a birth control, really important for the product and also for those that are using it. And then we've also done some studies looking at fertility, because you can use natural cycles to plan a pregnancy and also follow a pregnancy too. A paper that Joyce was involved in a couple of years ago now was really fascinating, just collecting 600,000 menstrual cycles worth of data and looking at what those cycles look like, when was the average day of ovulation, how much cycle variability was there, and really busting some myths that had been clinically believed for a really long time. And then also sort of research contributing to women's health, like that paper I just discussed. But then also, I think obviously the pandemic's been talked about lots in research, but what was really nice about the pandemic was that users were reaching out to us. And again, that clear dialogue that we have saying, I'm noticing this, I had my vaccine and this happened, I got COVID and this happened. So, and that being applicable to so many other sort of conditions and how we could be responsive. So we were then able to collaborate with academic institutions in the US at the NIH, perform research and actually feed back to the users and to the wider kind of women's health population. What happens when you get your COVID vaccine? What happens to your cycle? What happens to your bleeding volume or the length of time that you bleed? And that research is now kind of ongoing. So what happens when you get the flu vaccine? We've had that one for years, and we've never really considered what happens when you get ill in general. And that's why I've kind of called that rapid research. So I think as a theme throughout all of these talks today, there's the education side to natural cycles. So that's our blog, our in-app messages, our tutorials. There's the empowerment, which I really like. So I used to see patients all the time. And this was kind of, I feel very old now, but this is before the days of apps, I guess. But being able to walk in to see your GP or your healthcare professional and say, I can see this, I have the data that supports this, what can we do to help? And having that power in the form of the data. And also raising questions, so I can see that something's changed. Why might that be? Please investigate this. We've got the science and the research, and the key thing is for the science and the research is that we couldn't do it without users inputting that data. Although we've got lots of ideas and the academic institutions want to do the research, without that data that women contribute, we couldn't do anything. And then also community. So I know that there was talk yesterday on social media. We have a big community, around 10,000 individuals in a specific closed Facebook group at Natural Cycles. But then, as I said, also that support and that dialogue between us and the users themselves. And another thing that we've had sort of during our research is things like pregnancy loss, when we're able to send a message to users that have experienced a pregnancy loss, and that kind of virtual support that they've really appreciated that hasn't been available necessarily by their healthcare provider where they are. And I think that's really powerful when you think about, you know, sometimes people might say it's just an app. So that concludes my talk, and I look forward to questions at the end.
Thank you so much, Jack. So our last speaker is.
Carry on, no, carry on.
Our last speaker is Anne O'Neill. So Anne is the founder of women's health startup Adora Digital Health. Her first career was spent in some of the UK's largest broadcast companies, and then following a long career break to look after her children, she returned to the workplace and fell in love with startup life. Anne is building a digital health app to help women understand and get educated on their menopause symptoms and quickly get to treatment and solutions they need. I'll now pass it on to Anne.
Thank you. I just realised it's a PDF, isn't it?
Yeah,
Right, okay.
sorry.
It's all right. Right, I hope I just want to do one quick check. Slides are not changing for people online. Apologies for that. I'm not quite sure why. They are changing for us. Yeah. Bear with us. You could watch again if you want to see the slides. They'll be on YouTube. I'll hand over to Anne.
So I just scroll or flick within that.
I've never used a PDF.
Okay.
Oh, yeah.
Did you do that by magic?
No, I just I don't know how you go backwards though on a PDF. Anyway, we've missed the first
Okay,
slide.
the first slide was just a picture of me, so it's really good that we've skipped very quickly to the second slide.
There we go. We'll just move them. They're down the bottom.
So thanks, Jack, and thanks, Kimberly. I have to say it's really interesting listening to other app makers discuss how they are benefiting women with their Femtech, and common words, empowerment and information and data. So I'm Anne O'Neill. I'm the founder of a very new startup called Adora. It's good to be in the room with Flo and Natural Cycles, who giants of Femtech, even though they themselves aren't that old. We are trying to help women when they get to the end of their menstrual cycle, so in menopause, and our platform is all about empowering literacy and signposting women to things as quickly as possible. I'm really excited about what's going on in Femtech. There's lots of innovation, there's lots of new ideas, there's lots of research, there are lots of grants. Even the US government are making money available to look at things like menopause now. It's definitely on the radar. Femtech, as Joyce said, is having a huge growth in terms of investor money going in. So that's really exciting. So if you're thinking about Femtech, good timing. But there's not much of menopause, I have to say, which I discovered when I hit menopause. And that was the opportunity that I thought, okay, let's do something about this. Menopause, I'm sure you know most of this, but menopause is natural life stage, and it happens around 45 when your hormones start to fall, your periods start to go a bit chaotic. And even though it happens to every single woman, half the planet's population, and by 2030 1.2 billion, most women are unprepared for it and really surprised when it happens, and for ages they don't recognize the symptoms they're experiencing as being due to their menopause. 80% of women experience symptoms, 50% experience emotional symptoms like heightened anxiety or irritability or low mood, often for the first time in their lives. So women who never really struggled with mental health issues suddenly find themselves crying all the time, or not able to drive on the motorway, or just shouting at people around them, and it can be really upsetting. For 25% of women, and these are normally the stories that you hear in the press and social media, it can be very severe and it can have a big impact on their lives. So the question is, and the thing I really want you to take away is that even though it's a collective experience, for every single woman, it will be a different journey, and everyone will experience different things at different times, respond to things in a different way. So the question is, from a Femtech perspective, how can we meet women's new healthcare needs at this time when every menopause experience is different and we don't have enough menopause specialists to go round to deliver that personalised care. To talk about that bit today. If I can find the magic button that you press the right, okay. Sorry, trust me to be different and send a PDF.
What did I do? Oh, there. I just pressed the big one.
Okay. So one of the things about menopause is there are about 40 symptoms, and some of them are well known, like hot flushes and night sweats, and others less known, like brain fog. And in fact, I've got notes because I get brain fog, and what it feels to me is sometimes I would just look at Joyce and forget her name, and you can't access it, and it's the weirdest thing. So it impacted me in my work performance. So I now use notes to make sure if I have that, I have to get it around it. And that's one of the things about menopause. You have to find ways to deal with things that are impacting you. But as I say, 80% of women will experience symptoms, and women aren't educated in this. So for a lot of them, lot of the lesser known symptoms, they don't know what they're experiencing. And that was kind of my story. So when I got to about 45, I started to experience things. I had pins and needles and I had electric shocks, and I thought there was something going on with my central nervous system. I was sent for lots of tests. My GP didn't recognize it as being due to estrogen. And anyway, I thought something was really, really wrong. And it wasn't that, it was the start of perimenopause. And eventually, I talked to the GP about something to help me because I wasn't sleeping and I had joint aches, and I had a bit of a battle about HRT because my GP thought that it was too risky because there had been this study 20 years ago by the Women's Health Institute which linked HRT to increased risks of cardiovascular disease and breast cancer. And actually it had been disputed and proven not to be the case, but my GP was working on old information. So the whole thing was a muddle and confusing. And I sort of came out the other end, started talking to people, started looking for a tool like flow or natural cycles to help me. And I realized there wasn't anything. There was no innovation in this area 3 years ago. So I thought, well, that's the solution that I'm going to start to build. So I reached out to my co-founder, who is an AI engineer, and together with Dr. Karen Morton, who is a senior gynecologist in the NHS and a menopause trainer, we started to put together what we felt would be a really helpful tool for women. And one of the things that was really driving me actually was the gender gap, the pay gap, the lack of women in senior positions. You heard AJ say, I took time out after our children. A big chunk of my career was spent at home because the maths didn't work out, and it had to be me who kind of sacrificed my career. I was determined to come back into the workplace. Just as I was getting back in the swim, wallop, menopause. And so I was really driven to try and help women, especially in the workplace, because the Bupa found that 1 million women had left the workplace because of menopause, and the Fawcett Society last year published that 1 in 10 are leaving because they're not able to manage their symptoms in the workplace. A lot of workplaces aren't set up to support older women, even though it's the largest demographic in the workplace, women over 45. So we're creating a platform that uses conversational AI and natural language understanding to personalize the healthcare that we give to women, and to create a relationship with women as we do that. So I heard, I think it was, you said you have chats in your app that engage on specific symptoms. So that's something that Adora is doing. And that's because you've got 40 symptoms. You don't want to be wading through 40 articles. You want something, especially women at this stage in life who are busy, you want something personalized, you want something relevant, and you want something that is going to help get you to some practical action very soon. So we're testing it, we have tested it, and we're now running pilots with businesses, and we're talking to the NHS about how to do a pilot with them, just in terms of the enabling technology behind it. We're collecting profile data, we're collecting symptom information from women, and the data we're collecting is actually the second kind of exciting part. We want to create the largest menopause data lake in the world so that we have better information, better insight into what's really going on. And the reason for that is because it doesn't really exist at the moment. So this is the first generation of women who are going to be able to contribute to that. And like Joyce said, women are keen to share health data because they know that's the only way things are going to get better for them. So that's what we're doing. And I think the approach is we are differentiated in the market, and the conversational chat that we are creating, the dynamic chats, they are validating the way women are feeling, but they're also supporting women. So one of my favorite conversational apps is Wobot, if anybody wants to learn about them. But they're another relational agent, and they talk about the therapeutic one they're able to create with users, which we're also creating. We had a woman called Hannah who never spoken to anyone about her menopause. She was one of our testers. She worked in a call centre. She was working with quite young people, so there was never any chat about menopause symptoms in the workplace. And she used the Adora app a lot for education, literacy, and also for support. And she said to us one day, you know, I went on the Adora app and it asked me how I was, and nobody had asked me that all day. She said, and it felt like a hug. And for us as the creators, it's just a piece of software, but it's much, much more than that. And it was able to give her the support she needed at the exact moment in time. And that's true whether it's Hannah at the end of the day or a woman working at 3 a.m. with night sweats again. And that's why I think that from a Femtech perspective, we've got you know, an awful lot of opportunity to help women by collecting data and gathering insight, but also just supporting and validating and getting them to treatment quickly using the power of tech. So that's me. So thank you very much.
Thank you so much, Anne.
Okay.
We can now begin with the Q&A. So do we have any questions? And online as well, please.
Anyone online like to put any questions in the chat? We've got the chat open now. And what we'll do, because I think the dynamics in the room might not be brilliant, I'll read out, between us we can read out any questions that anyone, so we can say it again in the chat. Can I start? This is a bit controversial, but I'm gonna say it. We're doing some projects now with the trans men and non-binary and gender diverse people who may still be having periods. And I've hit some controversy already on social media about it. But the more I've looked into things, I think, I mean, we've got a website called Menoclarity, which is about women that go through a natural menopause and trying to help demystify some of the myths. And we were told, why isn't it diverse? Why isn't it helping everybody? But the aim of this is just to help people who are having a natural menopause. So it's not even for those that have a premature menopause, and it's not for those gender fluid people who would be going, probably, if they're having hormones or other treatment, through a very quick early menopause as well. And the more I've looked at it, I think it's sometimes really complicated to try and cater for everybody in one space. So even when I wrote my book, I said, this is really a book for women, and I appreciate that there's lots of fertility education that we need for the LGBT community, but that needs to be another book. I just couldn't figure out how to do it. I tried, but I couldn't figure out how to do it in the same space. So with Menoclarity, I've said that we're just dealing with a small group of people. Well, there's a big group of people, but we can't deal with every group in that space, and we need other work around that. So I think with all of your apps, that would apply. And I wonder if we start with Flow, maybe if the panel wanted to come up, so we've got, we can hear a little bit more. If we all sit near this then, so we can hear on the Zoom. But yeah, and we've done work on period trackers, and yes, they are very, they can be quite pink and they can be flowery, etc. But I just wonder, and we're doing the research, we are going to ask people in our survey how they feel about using a period tracker app. So trans and non-binary and gender diverse people or fluid people. So, and I think, I don't know, you never know with research, sometimes get the opposite answer, but I think they're going to say that they're too feminine. But maybe we just need different apps to suit different people. but I'll shut up now. So I'll let Kimberly start with that.
Sure. No, I think that's a really great question and a really great point. And yeah, maybe the answer is different apps. I think that if you use Flow, or you'll notice that ours is very pink and a bit flowery and feminine, but that's something that we are working on. Some changes to and making sure that we use more inclusive language as well. But yeah, I don't know, perhaps it's a different app, or it would be great someday if you could really personalize it more to you, depending on how you want to be referred to. And I think some of that is already possible, but there's a long way to go.
Do you think if you try to use gender inclusive language, do you not think you offend some women? So I've had social media problems in both respects this last week. I've had the women say to me, there's, we're women, we're not cis women, we're women, we have menopause. Why are you cancelling us? Why are you omitting us from the conversation? But then we've also got gender fluid people who also want to be recognised. So I just, the more I'm looking at it, I may be wrong, and yeah, I just think maybe we just need to have separate spaces, but because otherwise you're going to offend somebody. So do you think Flo is do you not say woman anywhere on your, or do you say?
We do.
You do.
Women and people who menstruate, I think, is often how we phrase things. So trying to
cope for both. Yeah.
I suppose, so we're quite an early stage product, and we we have a mission to not leave anybody behind. But for today, with the resources that we have, we're looking at women. We can't get to other groups who desperately need help, education, assessment. Everybody who has ovaries and has a menopause needs this help. And there are lots of groups that we just can't get to yet, but we will step up to that as we get better resourced and move forwards. So for us, it's about using tech, because tech can solve things at scale, using tech to help groups that aren't getting the help because the resources aren't there in kind of the healthcare service, or aren't there in private medical groups aren't covering them. This doesn't quite answer your question, but giving you an example of how Adora can scale, we can scale by different language, we can scale by different literacy age, so that if you have somebody that second language perhaps living in the UK, or perhaps you can't read and write very well, they can still access the education they need. So tech is a solution to creating things at scale and making sure all groups are covered.
Yeah. And Jack, I might just pass the laptop round just so that those online, because they've only got 23%.
Sure.
So you don't just see
probably get a
mine.
chin view, which is my favorite. I think that this is something at Natural Cycles we've come across during our development, same as Blow. We try and use gender inclusive language where possible. We also acknowledge that we don't use it when we're writing research papers, because sometimes when we're talking about women, the academic and the clinical community are behind, or it needs to be defined as a woman, or and things like this. So I think having that open dialogue helps. I love the idea of personalization, depending on education or how you identify. And I think the main thing is that we keep the dialogue open between all groups. There's also a huge commercial aspect to this that we can't ignore, which is that a huge number of people using the app are cis women and identify as such. The app becomes tailored towards them because they're the largest group. It definitely doesn't mean that it's fair, but then we're also trying to sustain ourselves so that we can carry on performing research and funding all other aspects of the app. So great point to raise, and definitely worth continuing to talk about going forward.
It's tricky. It's
very tricky.
It's tricky. And I think people have been afraid to ask that question. I've decided just to go for it now because I've already been shot down by both sides. I got shut down by some trans community and by some women who both shouted at me at the same time about different posts. They were different posts, but I think we need to do it, because I think we need to hear from everybody, and we need to see how we can help everybody through these different life stages that your tech deals with. And I know it's called Femtech. I mean, that's a problem in the title, but I don't know how we get around that. Has anyone else got a question? Yes.
you all represent and the research student makes a lot of benefits to each other being presented. But also around the focus around employment and experience and what areas of interest do you have?
So just in case you didn't hear, so it was about looking at qualitative research, which I'm a huge fan of, quite recently, but it's just so amazing. Yeah. So maybe I'll just, it's running out of children.
I'm happy to go first. So because we're an early stage product, qualitative research is really, really precious and vital. We do loads of it and we learn every time that we do it. And in fact, we just we just ran a grant funded research study with Anglo Ruskin University, and we did a study on bonds that I talked about with women and software, and we're developing that. So I think it's hugely important. It's hugely important when you're starting product development, because you have to understand how your product fits into a woman's life and how she's using it, and where the pain points are and where she's delighted by it. And so
Sure. So at Flow, we have lots of qualitative research, although it's usually in more of a user research. So lots of interviews with people, and we haven't, so it's not been published in the same way as more of our quantitative research. But that is something that we're looking to add, and especially it talked about our symptom checkers that we're developing. And so that's something that we're starting as some qualitative research on how people feel about the symptom checkers, and how they want to be told about different things, or how they experience their symptoms before their diagnosis and things like that. So we are looking more and more into qualitative research that we'll be able to publish, in addition to the kind of user experience type research that we use to improve the app itself.
And the natural cycles, a few years ago now, we funded some qualitative research with Rebecca French at the London School of Hygiene and Tropical Medicine, looking at people's views about using the app to plan pregnancy. And the results of that showed that obviously the app was extremely supportive and useful, a great companion for that journey. Some people saw that they were high fertility and had sex right there because they felt like it really stimulated them to connect and to have that sort of planned sex. And then the other side of that was that a lot of users felt the pressure and they didn't like knowing that they were high fertility. We know that our users use the app in the opposite mode to what they actually intend to use it for sometimes, because they don't want to know they're highly fertile. So that's some research that we've done. We've also got some really nice qualitative research coming out on natural cycles users, performed by Karolinska University in Sweden. I mean, this research, it's not been published yet, but the results, I can say that it involves kind of drawings from users at what things about the app represent and mean to them. So we'll connect afterwards and I'll be able to share those insights with you. But qualitative research, as you can tell, like Joyce and Chatty, love to hear user views and also love to kind of scientifically analyze that. So I'll share those papers with you.
And that's exactly, luckily, the women's health strategy was all about talking to women about their health to hear. So that message is getting out there, that's really important to hear. And it's a thing I tell every company who ask me what they think they should do. I think speak to the people you want to work with. And a company recently said, oh, but we're speaking to the clinicians. I said, no, let's speak to the clinicians. Speak to the people who you want to use your services. They're the ones who are important. I think we've not done that for a long time, and now's the time. There was a question from Vasanti.
Yeah, so I'm not very tech savvy. I've got a little app, and I guess my question is, if I think aware of the certain demographic that are not using apps and they're missing out on the opportunity that we've actually here to be giving, and is there any way of involving them? I also know that there's a lot of issues around trust of data as well, and that's the reason why they don't want to do that and don't want to give their data to companies So, I mean, that's something that we need to take the message, yeah, get your thoughts on that.
I'm not sure if you could hear that, but she said about the people, not everyone uses an app. So for those people that are not using an app, how can we engage them? And also about data, that people using apps are obviously giving lots of very personalized data.
I'm sure I can start there. So, data and data privacy is really important to us, and especially in the aftermath of Roe v. Wade and the concerns about that be launched in anonymous mode. So we could kind of separate, users, basically not have their personal information connected to their health data, so that people could feel protected, and people who wanted to use apps that were hesitant because of the data privacy and security issues, to be able to make it possible for them to be able to participate. I guess I'm not so sure in terms of the, people who don't use them and, maybe aren't interested. It's interesting because I think now that I work at Flow, people are talking to me about, that they use Flow or how they like to track their periods. And I think my favorite one is someone who does it in Google, their Gmail drafts. So, and that works for her, and that's what she likes to do. So yeah, but I think you're right, data privacy and that is very important in Femtech more broadly.
Yeah, I mean, it's crucial to any app developer. You've got to take it seriously, and you we believe at Adora, I'm sure we all believe, you've got to be really transparent and be really clear what you're doing and why you're doing it from day one, and then give people the option to get involved or not. It's really important to us to understand more. We'll only be able to do that if people want to share data. So we've got to, that's precious, and we've got to make sure that the security is really, really tight. And your question's quite relevant to our audience, because we're talking about an older audience who perhaps, yeah. So we are aware of it. I mean, there's no, if you have a solution, I'd love to hear from you. I'm not sure. Yeah. But one of the things about the menopause is that women are very good at supporting women through tough times. You possibly first experience that if you have, go through pregnancy, and then afterwards that kind of time when your mind is, you're so tired, and women can really understand that. And it's the same with menopause. Often women don't talk about it, but as soon as they start talking about it, they don't stop talking about it. And I mean, that was our Hannah, one of our testers. She'd never spoken about it. She ended up going into the workplace and starting to talk about it and educating people. So I think the community part of the Adora app is always going to be really important. We just have to work out how we get women involved in those communities if they're not interested in apps, and there are plenty of women who aren't interested in apps, so want to be on their phone. But there are, our audience is going to become, is coming from the sort of tech savvy group, so it's going to become less and less. And there are, I think, for menopause, there are some very embarrassing taboo kind of symptoms which women still won't talk about to us or to their GP, and the outcome means that they're suffering at home. They're not getting the stuff that they need because they haven't got the confidence to go and talk to their GP about incontinence or dry vagina or any of these things that are really impacting on their lives. And we hear a lot of stories from our gynecologist, Dr. Hamilton, about that. And so the positive thing is they can come onto Adora and they can find out about that. It's very private, intimate, and they can find out what they can do about it. So there are really good sort of reasons why an app is brilliant for that sort of management or something. But we again, we've got to step up and we've got to think about how we can be inclusive.
I think from my perspective, if you think about traditional fertility awareness-based methods of contraception, they involve sort of manual charting, which was labor intensive, which is, I guess, why apps naturally developed to make that more streamlined. I think from an app development perspective, what I would say was those that aren't tech savvy develop the app even further to make it even more user friendly for people that don't like using tech. And so I'm imagining it literally just being press a button where you're in, don't do anything, and you will be notified. You don't need to explore all the different tabs. So there's a responsibility there for us to make it even more seamless for a different type of user, and personalization there. talking about your tech level, that would be great. Second of all, data privacy, exactly the same as Flow. We've also developed an anonymous mode. This is something that we're navigating. It's kind of chicken and egg. We're navigating this as a tech company at the same time as kind of those laws develop. But I think we have found a way in a similar way to Flow to protect the user at this time. And we're just continuing to develop that as a priority.
We were quite shocked in our research that we asked the user, that it was a women's survey about using period tracker apps, and we asked them about how they felt about their data privacy. It was before Roe versus Wade, and it was mainly UK people, but they weren't that bothered. I was shocked, but I've heard other people that also checked the same and found the same. I think nowadays, yeah, they were using an app. They were, yeah, exactly. No, I take what you mean, that there are people that are using the app, but I think that certainly, I think from what I've heard in the UK, how many times do you press I agree to terms and conditions? Every time you update your phone, I agree. Does anyone read it? No. So I think we've all just, but maybe some of us have become accustomed that it's all out there anyway. They're all tracking everything anyway. So, but there's a couple of questions online. This is a great question. Given that every Tom, Dick and Harry has an app out there with several publications on inaccuracies, do presenters have any comments about the unregulated nature of Femtech products, unsubstantiated claims, shoddy science, etc.? Who wants to go first?
I can go first if you like. So I think I have first-hand experience of this working at Natural Cycles. I joined in 2018, just after we had our sort of PR crisis with 37 pregnancies in Sweden. And then, we were investigated and our research was put to the test. So our effectiveness papers and our monthly KPIs were investigated to look at whether what we claimed our effectiveness was really the effectiveness that we were achieving. And it was found to be correct. I understand that clinical trials are the gold standard in research. It's very hard to conduct a clinical trial in contraception specifically. Is it ethical to sort of do a blind randomized control trial giving the pill or a fertility awareness method? That's complicated. We're trying to do the best science that we can in collaborating with best academic institutions out there. I would say though that there are a lot of femtech companies and apps out there that aren't regulated, and Joyce has a personal interest in this, or a professional interest too, in that using a calendar app as a contraception without regulation is not the best idea. Choice is really important, and I think it's important to explore all options. But regulation is there for a reason, so we try and achieve that and maintain high standards.
Thanks for sharing that, Jack. Yeah.
Well, I suppose on the menopause side that it's been quite a recent explosion of interest. So, my story, I looked around for something to help me, and there wasn't something. So I thought, well, I'm going to be part of the solution. But what I would say is I have noticed, and so there are a few more apps, but more than on the app side, what I've noticed is there are a lot of people talking on social media and giving advice. And that's what worries our team, because, they are listened to when people buy product as a result of seeing a video or hearing somebody. Regulation hasn't caught up with that. So it's not what we're trying to do, but I do think if you're a responsible digital health company, you will put distance between those kinds of product sellers and yourself by research, by certifications, by approvals, whether that's medical device approval from the MHRA here or FDA approval. And so I think in time, over time, that the consumer will be able, because this is what it's really important, it's about the consumer, it's about the user, they'll be able to work out who to listen to. So that's what I'm hoping.
Yeah, I don't have too much to add beyond that. Besides, yeah, we're trying to make sure to show that it's credible by having a large board of doctors and things like that, and putting that information out there and trying to make sure that it's clear and credible. But yeah, what to do for everything else that's out there,
It's a challenging one.
I've been to a lot of Femtech. I go to a lot of Femtech events, and I hear some. I've told you about one earlier, which I will not name now. But I hear a lot of about lots of products, and I think, wow. And I've asked them, "Where's the science? Can you show me your papers? Can you show me your validation?" And they can't. So it does really worry me. And they get investment. So none of them are here. These are the ones that I know. These are select ones. So there's lots of bad Femtech for sure, unfortunately. So the last question.
Yeah, so if there are some new topics that researchers and app users would like period tracking / menopause apps to address, topics that are not typically part of period tracking apps, but that are very important for women's health and disease prevention, would existing app providers see a value in adding new alternative tracking modules to their existing apps? What would be the primary concerns to app providers in terms of branching out?
It's a tough one. To finish on a tough one.
I mean, from a product perspective, products changes the whole time, and it's fluid. Good products that are still here in 50 years' time are the products that have reinvented themselves and listened to their users and understood what people need. And that doesn't matter whether it's Femtech or whether it's I worked in TV and radio, whether it's a radio station, or doesn't matter. Good products need to constantly reinvent and understand their users. So I would say success depends on that approach.
I don't think there's any problem with or concerns about branching out. I'm just thinking about some research that I've been discussing this week with an academic, and we were talking about autoimmune disease and certain conditions that they were very, very interested in applying for funding for, but some of them with such a low prevalence that then when applying that to our user base, we probably wouldn't be getting a fantastic number of individuals that we could then perform statistical analysis on. But that said, we've performed research on all manner of parameters. We've not necessarily integrated them into our product, which remains to be, sexy and, functions very easily and fantastically. We would just perform more of a survey-based research. So we're still able to sample the users, but it doesn't get incorporated into. So that's one way.
Right, brilliant. Well, we're exactly at 2 o'clock. I know we started a few minutes late, but there's no one banging on the door. I was looking. We were banging on the door earlier. So I'd just like to thank our guests very much. I thank our wonderful chair. It's been a really interesting session. I'm sure some things we'll think about later. And happy International Women's Day, everyone. And thank you very much, everyone who was online. I don't know why the slides didn't. I hope some of them did, but thank you all very much.